This video is to show the active, passive and resistive movements for the shoulder. When you're testing the shoulder, it's possible generally to test both sides at once, so you don't need to do good side and then bad side, get them to do both sides. As per normal, remember to ask them to tell you about any pain, discomfort, even the slight twinge, because remember a lot of people will only think that pain means excruciating pain, so ask them to tell you about any stiffness as you ask them to do each one. And in each case demonstrate beforehand. So as an example, with the flexion of the shoulder, you're going to say to them, what I want you to do is that with your shoulder. That would happen each time, but for the sake of this video, what I'm now going to do is just ask Tom each time to go through the movements. So the first thing that we're going to do is flexion of the shoulder. So if you can do that with your shoulders. And let me know if there's any pain, discomfort.
No pain.
What you'll notice, if I ask Tom to do that again, and that's a very common thing, is that the elbow will start to come out as they go up and come back down. So that's one of the things you can watch for. You now want to be able to see them from the side. Now, if you can walk around them, that's better, but in this case, if Tom just angles himself slightly so that you can look from the side, and what he's going to do is we're going to ask him to put his arms backwards. And what you're looking for is the angle that you can bring them backwards, is that equal? Okay, and bring them back forward again. And now you can get them to face you forward again. And we're going to do abduction. So that's flexion and extension we've done. Now if we ask them to do that, if they put their thumbs and back down, if they put their thumbs to the top as Tom did, that will make it easier. Some people can put their hands this way, which means they're even more flexible, but at least try and get them to do it with their thumbs like this. The next one is abduction, and that needs to be done one arm at a time. So if you ask them to take their arm across their body, you do the good side and then you do the bad side. Okay, and that's adduction. Medial and lateral rotation can be done in two ways. The first one is if you ask them to put their elbows into their waist, keep their elbows there, and for medial rotation all they're doing is taking their arms across. But there's very few people who can't do that, and I'll show you a better way to test that in a minute. Lateral rotation, many people like myself are very restricted, but he asked them to do that. And as you can see, Tom's elbow here is coming away from his waist, so he brings it back in, and you make sure that he keeps his elbows into his waist. Okay, and come back to the centre. A better way of doing that is if you take your arms like this, that's the neutral position, lateral rotation is there, and medial rotation is there. And as you can see, Tom's got problems with his medial rotation. Okay? Another way to test medial rotation and adduction is ask them to put their hand behind the back. So if you again get them to, so you can see what they're doing, and see how far they can go up with their good hand and then their bad hand. Okay? And another combined one is what we call APR scratch test, where you take them and you get them to try and touch the opposite side shoulder blade. And that is abduction and lateral rotation. Okay? And that's the active movements for the shoulder. If you we'll keep now go on to the passive side, and this time if you ask them to sit down, again you would do good and then bad, but for the purposes of this video, what I'm going to do is just one side. You're feeling in the shoulder joint, so this is the point where you're doing it here. So the first thing you're going to do is flexion. So take hold of the elbow, remember to get there, you're doing the work, so make sure that they give you the weight of their arm, and you see what that feels like. What's the end feel like? Is it springy? Is it wooden, as this one is a little bit? How does that end feel? So that's flexion. You can then go straight into extension, and again you're feeling to see what the end feels like. We can then take it into abduction, again put the thumb to the top, and you're seeing how far that will go up. Adduction, across. Notice we're doing exactly the same movements as we did with the active. And then medial and lateral rotation, so we get them to bend their elbow and we take it down, supporting the arm. You need 3 hands if you're going to feel the shoulder here as well, because you do need to support the arm here. So that's medial rotation and lateral rotation. But you can get a feel, despite the fact I haven't got my hand on the shoulder, you can get a feel for what that end point's like. So that's your 6 movements for passive. And then resisted, remember it's mid-range that we're doing, so we take them partially up and we then get them to carry on up in flexion. Okay, that feels reasonably strong. You can take it from the same point in extension, so you get them to push down. Okay, take it across. Now abduction, you may well want to test in different places because there's a sticking point here. If you look at the anatomy of the shoulder, you've got the greater tuberosity getting in the way at this point of the shoulder. So if you're going to have any problems at all, it's going to be round about here. Very often if you get somebody past that point there, they can then do the rest. So when we're talking about actually resisted movement, try it there, so get them to push up there. But if that's not possible, take it down a little bit, get them to push up there, see what it's like there, take it up a bit, and get them to push there. So that's your resisted abduction. Resisted adduction, take it to here and get them to pull across their body. If you put your hand on the elbow, it'll stop them bending their arm. And now resisted medial and lateral rotation, so there's our neutral point, so they're going to push their hand down for the medial rotation, and they're going to push their arm up for the lateral rotation. And again, I'm supporting them here at the elbow. And that's the resisted movements. Okay.